Wir hören den Vortrag über das Projekt Improve Age, Förderung der psychischen Gesundheit bei geflüchteten Eltern und ihren Kindern. Das ist der nächste Punkt. Karim, du wirst auf Englisch präsentieren, die Folien sind auf Deutsch und wir gucken so ein bisschen, dass wir mit dem Mix aus Sprachen, wie wir es gewohnt sind, gut zurechtkommen. Viel Spaß dabei.
Yeah, thank you for organizing the anniversary today, and congratulations to Triple P. It's my pleasure to be here to talk about a project that collaborated with Triple P, that still collaborates with Triple P. I myself come from the FBZ as well, the same as my colleague Karim, and I will talk today about a different project called Improve Mental Health. So Improve Mental Health is a project, a multi-center project in different cities in Germany. So it takes place in the areas around Munich, but it's also in the entire Nordrhein-Westfalen. This is the team led by Professor Schneider and my colleagues as well. The project started with an initiative which that we all know about. In 2015, there was probably the largest immigration wave since the Second World War in Europe and in Germany. And what we know from previous research and from the data is that refugees are a particularly vulnerable population with young children. So a lot of asylum seekers that came in 2015 had a lot of young children arriving with them. Here we're talking about a total of 6.77 million asylum applicants in Europe. And Germany hosts the highest number of refugees worldwide with over 3 million. So among this population is a huge number of children, as we can see here in the next slide. Around 31,000, and what we know about this is that from the asylum applicants, there are around 37% under the age of 18 and 21% under the age of 6. Around 50% of the asylum applicants have children under the age of 18 from 2022. Go back to this slide as well. Sorry. Yeah. So what we know also about the asylum seekers is most of them came from Arabic-speaking countries, and around 50% of them have mental health problems at some point, namely depression, anxiety, and PTSD. This could be because of multiple reasons. This could be because of pre-migration reasons, so experiencing traumatic experiences in their home countries or on the way to Germany, to Europe. But also post-migration stressors that we know about. Integration into a new country with a new language and new culture can be very difficult, among the many other challenges that we know about in Germany and other countries as well. So like I said, around 50% of the refugees have mental health problems, namely PTSD with around 31.5%, depression with the same percentage, and then anxiety disorders around 11%. And like I said, there could be multiple factors. Some of the factors that are present in post-migration is xenophobia, discrimination, low SES, as we heard in the last presentation, among many other problems. This can contribute to a high prevalence in mental health problems. One of the protective factors that we know about is work, being able to work. So being on a residence permit that doesn't allow you to work, that increases the likelihood to have mental health problems. But there are other reasons listed there, like being separated from the family, having difficulty with the language, or living in asylum or refugee housing, which has substandard living conditions. And there's also many inequalities in healthcare services. So it's difficult legally for newly arrived refugees to find a spot at a doctor to get treatment for them or for their children. But when they do get a spot, there's also sometimes a lack of intercultural competence what does this mean? This means that when they do arrive to see the doctor, this could be as simple as language barriers, but it could be much bigger than that as well. A misunderstanding of the problems that the refugee went through, or an assumption of what they went through. This is similar with young children that arrived. There's a variation of percentage of mental health problems in the children that arrived with their parents and without their parents. There's anxiety disorders, depression, emotional and behavioral problems, as well as PTSD. And some of the risk factors that we know here are, like I said, pre-migration factors. So trauma related to war, being of the female gender, as well as post-migration risk factors. So one of them here is being parental psychopathology. Also, we heard how important or how dangerous that could be for children at a young age in the last presentation. And because of this, because of or a higher prevalence of parental psychopathology, there can be a lot of parenting difficulties as a result. Parenting can suffer as a result of the high prevalence of mental health problems. And then the pressure to integrate and having a dual identity of growing up in Germany but relating to your parents in your home country can be a risk factor as well to developing mental health problems. Some of the protective post-migration factors can be being with the family together. Luckily, with the Syrian population, we know that the majority of them are with their family already. With other populations of refugees in Germany, that's not the case. But also being supported by peers in school, by the teachers, and having a supportive integration culture that's not pressuring per se, but more supportive of their home country identities, as well as helping them learn the language here, also integrate with their classmates. The next slide, we've seen it before. I will just say a small point. So with the background of our project, we knew that we wanted to help refugees, but it was important to take into consideration that helping the refugees can have positive effects for the children as well. So the thought was to provide our study to focus on two factors, one being reducing parental psychopathology, and the other is increasing parenting skills. So how do we do this? We looked at how do our potential participants or our target sample, how do they access healthcare? They do it by accessing general practitioners in Germany, and most of the time they access Arabic-speaking Hausärzte. This can be positive for them because it is cost-effective, but it's very common in their home countries to also go to a Hausarztpraxis more than a psychotherapist because of the stigma that comes with mental health. So our target group was parents with refugee experience. In the beginning, it was exclusively just Arabic-speaking refugees. We've expanded the criteria to English-speaking or German-speaking refugees. So we've had now participants from West Africa, from countries like Sierra Leone, Congo, Nigeria, as well as refugees that we focused on in the beginning from Syria and Iraq. Yeah. So the idea is to implement this and eventually promote the good development for the children of the refugees who are participating in the study. And the way we do it is through two steps. You can see them in here. Triple P is used with the parents. They attend sessions online and then have phone calls that support them. And they have to attend 4 sessions with the Hausarzt to work on their mental health as well. So the first step here would be Triple P. And they have to go through 8 modules online. They focus on the positive parenting aspect. that helps with short and long-term positive effects on emotional, behavioral, and social outcomes, as well as improving their parenting skills. But we know from previous research that this also improves the partnership between the couple that are participating in the study. And we've worked on translating the program for our participants so that it's cross-culturally effective, and we don't have to use translators or interpreters for their participation. The next step was the sessions with the Hausarzt. Here they go through exercises that are disorder specific on anxiety, depression, or PTSD based on what the participant is diagnosed with at the beginning of the study. And they have hand-on exercises to deal with the symptoms of anxiety, depression, stress, and PTSD. And here they receive a workbook and exercises that are tracked from home. This might all be a little bit confusing, so I have this graph to explain the exact process for Improve. So it begins with a diagnostic session at the beginning, where we try to find out, does the participant meet the criteria for anxiety, depression, or PTSD? And then after that, they begin with sessions with the Hausarzt and the phone calls. Immediately from week 2, they begin with Triple P for 8 weeks straight. I don't know how common that is with you when you provide this service for parents here in Germany, but we try to make it like an intensive course. And at the beginning we had struggles, but with the help of Silke and Ronja, we tried to adjust how we work with the parents, how we accompany them throughout the program. I'll talk a little bit about that later as well. So they have 8 weeks of Triple P accompanied with phone calls with me or one of my colleagues who try to combine the aspects from the sessions with the doctor as well as the modules from Triple P. And we talk about their personal problems and how they adapt and apply the strategies that they learned from Triple P or the Hausarzt. And immediately after the 10th week, after they saw the doctor for the 4th time, they go through a diagnostic session once, and 3 months after twice, and then 6 months after is the 3rd and final follow-up appointment, where we try to see if the effect of improving their mental health has positively affected their children as well. So how do we work with the parents? Immediately after their first session with the doctor, they get access to Triple P. And first we clarify any questions they might have about Triple P as a whole. Here we get questions like, are we getting pressured to parent in a specific way that doesn't apply to our culture? Or are you going to go into private details of our life? And here we try to assure the parents that it's situations that they know of and dealt with before that they have to go through, like going to the supermarket and having a rough time with one of their children there, and how they can effectively deal with those situations, for example. And that they don't have to share anything, they can share as much as they'd like with us, and slowly but surely they get comfortable with one of me or my colleagues because we come from the same culture, we speak the same language in some of the cases. And then we move on to every week we talk about what was useful in each module, what was relevant to their situation with their children, what wasn't so useful and or is not implementable in their family. Luckily, the second question, what's not useful, is always answered, oh, everything was useful in this module, everything applies to me. So immediately from the first module, we see positive results with the parents, that they're very optimistic and happy about the program. And then we track them on a weekly basis. We have to be very flexible there because the parents might tell you next week at 1 p.m. and then next week at 1 p.m. you find out that tomorrow at 3 p.m. is better. So you have to be very flexible in accompanying them while they do Triple P. We asked them about the top 3 problems that they face with their child, which they have to mention in Triple P Online as well, and we try to track that on a weekly basis. How's that improving? Is the child getting better? Are they getting more comfortable, more able to deal with their child? And most of the cases, the parents say yes. And we also ask them about how positive their child's behavior is on a weekly basis. How do they see their child? So this can give us a perspective on how they view their parenting relationship to their child, as well as subjectively how their child is doing. So it sounds like a great program, but there are difficulties with it. So we knew that refugees need psychosocial support here in Germany, and we knew that they have access to Hausärzte in a general sense, that they access them, and that this is a common practice to go to the doctor when you're sick, when you have a cold. And we thought, okay, we'll recruit participants for our study through the Hausarzt. This was not successful, and we had to think about other solutions. I'll hurry up because I have 5 minutes. So our solution was to set up something called the Participant Advocacy Board, and this is now becoming a thing in a lot of scientific studies, is to have a participant board that represents the target group in the study. What does this mean? That means we try to get a group together that are trusted in the community, that have a network that is established already in specific cities. They are service providers either through language schools in Germany, or they work with an NGO that works with refugees. So they have a lot of contact with the refugees, and they've established a relationship based on trust. The problem is that refugees hear about projects like Triple P or other programs, and there's worries always that, is this connected to my residence permit? Is this connected to the Jugendamt? Am I in trouble for participating in this project? Will it affect my health care because of what they see online sometimes about different treatments? So there's confusion. The participant board helps us with direct feedback on the study materials, so on the flyers, on how we recruit. They also give us this direct contact with the group. And this has helped us a lot. We've met with them 7 times. We've had 2 groups at this point, and they can help assure the participants that there's nothing to worry about, that the participating does them only good. We've had more participants as a result of having a participant board. I'll just show this graph quickly. So before the blue line in May 2023, we had around 15 participants, and we started in January 2020. So you can see it was moving super slow. This was just depending on Hausärzte who had to deal with COVID at some point, and then had to deal with vaccinations at some point, and had to tell them, oh, by the way, I have a program called Improve MH, do you want to participate? So we have this participant board now who directly just contacts participants for us. Either they forward us phone numbers, or they give participants for secrecy, they give them a QR code where they don't have to tell them, okay, yeah, I will participate. And here we make sure that the anonymity of the participants is kept. The last 2 things I'll talk about is a focus group that we did about healthcare access here in Germany. And I think this is interesting because we asked them about how adults access healthcare in Germany and some of the negative experience that they've had, but also for their children, what are some of the fears that they had. And I'll go over the fears that they had for their children first for the sake of time. So a lot of parents in the focus group mentioned that, yeah, we have anxiety of pressure, that in Germany, service providers, teachers, healthcare providers are trying to move our children away from our culture or from our religion. And here they see integration in a negative way. rather than seeing it as an organic way that's happening to their children, they're seeing it as forced on their children. Another thing is if their children get access to mental health care services, or if they participate in a program like Triple P and the word gets out, is that there will be a lot of labeling or stigma that you're not good at parenting, so you have to do this, or your child is it doesn't have any good behaviors in school, isn't successful in school. But also they're afraid of racism when they participate in programs like this, that then there's a stereotype about their children being less intelligent and then losing their seats, for example, in the different school systems that are in Germany, so that they have to go then to another school and not the gymnasium. We will interview parents also about their experience with Triple P and the program in general. We've had 3 interviews so far. It's difficult to evaluate those interviews because everything is positive from what we hear from the parents. So there we have to ask more questions to maybe people who haven't participated in the study but maybe have an idea of what it is or are not afraid to share their true opinions. But so far everything seems positive. The last thing is I'll share some anecdotes from the phone calls that I've had with the participants, since I talk to them on a weekly basis. So in the beginning, like I said, there's skepticism about the program, that you're gonna push me in one way, but parents find that it is not culturally different, that the strategies suggested have been implemented by them in the past, or they've heard about it from a friend or a family member, so they're very happy to implement them and see immediate results. It's also, they immediately report that it improves the relationship of the couple, it improves the communication style between the couple and the parents. There's less stress for the parents, so they can take care of themselves more, and we know from previous studies that Triple P not only helps with children, but also helps with the parental mental health. So that's something that I've heard from the participants directly, is that because at home it's much easier, they have more time for themselves and there's less stress for them. Yeah, I'll end with this, and just a statement that the study is financed by the BMBF. And yeah, thank you for your attention.
Ja, vielen Dank, Karim. Hier. Oh, hier, Karim.